Good afternoon, everybody. Scott Fisher with Senior Resource Connectors once again with you. Thanks for spending a little time with us. We are in season two, and as I share with our audience each and every time, we formed the Connectors a little over 3 years ago with the intention of pulling together some of the absolute very best um, providers that walk along families during the aging journey. And today is no different. Today was one of the first people I talked to back in 2021 about joining us. Aaron is the owner of Devoted Guardians Home Care and Home Health Services, and we met probably 10 years ago as Aaron was embarking on building a business. Devoted Guardians has a presence all over the valley. They serve hundreds and hundreds of families and probably thousands over the last 10 years or so, Aaron. And so I just want to introduce you to everybody. And hey, thanks for joining me today. It's good to see you.
Uh, Thank you so much, Scott. I really appreciate this chance to talk with you, and really appreciate what you guys have been doing out in the community.
It is with each month that goes by, I'm telling you, more and more families, the adult kids specifically, are finding access to us because they are in the midst of it with a family member who is starting to have a shift in their care in their healthcare needs, or they're having a shift in their cognitive status, right? And thankfully, there are providers like you guys that step into that space and help people at home. It doesn't mean they have to leave their home yet. Actually, you guys come alongside people and help them in that moment and help support that quality of life so that they continue to live with purpose. Everybody, a little bit about when I said home health and home care. Start with the general conversation that those things are not the same, and then talk a little bit about specifically about what you guys do at the Devoted Guardians and makes you special.
All right, great. Thanks, Scott. At Devoted Guardians, we have two different entities, and so in the home care industry, there's some different sectors that really make up what home care is. So the largest part of our business is on our personal care side, and this is where we are going into the home and helping our clients with the activities of daily living. A common term is ADLs, is how people speak about it, and essentially helping with all the non-medical required tasks. So it could be helping someone get out of bed in the morning, get up and dressed, getting some meal prep, maybe doing some grocery shopping, reminding on medications, doing laundry, doing dishes, just all personal care, helping with showers, and really just making sure that our clients are safe as they are moving around the home, and just making sure that we get eyes on to really make sure that they're doing well and stable, and really trying to keep our eyes open to any sort of change that might illuminate to us that an intervention might be needed. So that's kind of on our personal care side of the business. But I'd say the other side of the industry, and there are more than two, is on the home health side, and this is where we try to meet our clients with their overall need. If they need some medical type services, they need some medication, medisets set up. If they need nursing services, maybe they have wounds that need care. Maybe they need physical therapy, occupational therapy. This is where we're able to bring in a higher level of service that really addresses any sort of medical needs that they're going through. To really, overall goal is to help keep our clients home and keeping them happy and healthy. And what we've seen is that home care really does involve more than just that personal care side. So we've been really trying to build our company in a way that we're able to be a one-stop shop for anything that our clients might need in that home setting. We're not all the way there yet. It definitely takes time to really build that, and we want to build that in a smart way to make sure that we're actually able to execute the services with the vision that we have in mind and the quality of service that we're really looking for. But with those two pillars, we're really able to do a lot to make sure that the care is being delivered properly and that the client is thriving in that home environment.
Talk to me, but just a second then on the home care, the private duty, the non-medical side. How is that paid for by people? Is that directed by a physician, or is that something that like me as an adult kid, I would call you guys and say, my mom needs this, this, and this, and so is that kind of how it happens?
Yeah, I'd say on the private pay side, there is no regulation and rules around that, and so it really is that normally the adult child who has seen mom or dad or grandpa, grandma, and that
Mhm.
something is off or not going right, and that there's a concern that their health is really declining. Maybe they're seeing that they're forgetting to take their medication. They're seeing that the home isn't as clean as what they normally seen. Maybe that they've had a fall and we're noticing that their balance might be off. So those are usually the initial calls that we are getting from
Mhm.
those family members to research services. So on the private pay side, there are some different ways to pay for this service. Obviously, just cash payment is always um, yeah, a given, but we also try to work through VA options if someone is a veteran or a spouse of a veteran, that there are some VA paid services there that we can help connect people to. And sometimes there's a long-term care policy that has been in place. And I think, we really urge everyone to really, as early as you can, get a hold of those long-term care policies to help, mitigate any of these costs as we age. And so we're able to work with a lot of those home care policy companies to execute the care, and they're able to pay us directly. I'd say, outside of private pay, there's kind of the other side of this industry, which is on the Medicaid side.
Mhm.
And there are times that families based on income and need are able to qualify for the Medicaid system, and that's where in Arizona the ALTCS system will step in and pay for those services and be able to contract with us directly.
Gotcha. And then on the medical side, is it insurance covered? Is it private pay? Is it both? Again, how does that happen? I spent some years working for a home health agency when I was still practicing my nursing um, profession, which is how I ended up in this whole world, 20 something years ago. But talk a little bit about the home health component.
Yeah, so for home health, there are a lot of different payers involved. Definitely private pay, the VA will authorize services. There's Medicare Advantage, there's private insurance, and then there is Medicare, and then
Okay.
also the Medicaid system.
Okay.
And one thing that I think a lot of people don't understand is that Medicare will not cover non-medical care costs. There are some Medicare Advantage plans that are providing a small benefit,
Right.
but we see, it helps a little bit, but you're usually not able to get enough to really provide that full range of care. So on the home health side, it's just there's a lot of different payers that we are interacting with, and we're able to work with all of them.
Are you on a bunch of the Advantage plan panels and things to be able to for people to work through some of those? Because sometimes the Advantage plans can be they're very picky. You have to use their provider for their services, so that's a little trickier game to play sometimes.
Yeah, if I hosted out all of the different insurances that we were accepting, this would be a very long
Oh wow.
discussion. But yeah, I mean, we do try to work with all of the major Medicare Advantage plans, and a lot
Okay.
of the organizations that are operating in the Medicaid space also have these Medicare Advantage plans. So once you
Right.
get contracted with one, you kind of get contracted with all the different options.
You make that point, and same thing applies to the degree that with the placement industry, a lot of times families will ask me, Aaron, they'll go, "Oh, what's Medicare? My dad's got, oh, he worked in, he's in, he's got good VA or old Champus benefits or whatever." I'm like, I'm really sorry, that's not going to cover that assisted living. They consider that custodial care, not skilled. So there's the differentiation. Even though they need medication services or whatever, the assisted living provides that, or you have to add another layer of service in to do the medication management. So talk a little bit more about this Altex. I hear that, and people ask me about it all the time, and we talk about Medicaid, Altex. Um, how do people get involved in all that, or what's in? Because you mentioned the two components. There has to be a financial need, and they have to. I say they have to fail the test to pass. They have to take um, a standard assessment that measures their functionality at this point, right?
Yeah, they're going to have to qualify based on income and assets, and then also based on the physical needs related to care. Those who qualify for that program will be able to choose a insurance company that is working within the ALTCS program. ALTCS stands for Arizona Long-Term Care Cost System. And so, this is where the Medicaid system operates there. And so once they qualify, they're able to choose the insurance plan that best suits them, and then that's usually when we are able to get referrals from the case managers that are working at those plans. But families are able to contact us directly prior to that, and we can work on getting people set up and ready. So once the ALTCS approval does come through, we're able to kind of hit that ground running, and we've already established a relationship and a plan of care and are able to make that process work faster. And one of the nuances within the ALTCS program, which I think a lot of people don't know, is we are able to hire either a family member or
Mhm.
someone within their network that they trust to be that paid caregiver for them. And we find that that is some of the best situations available because they're already comfortable with that person. That person, is usually very caring about the individual because they have that personal connection. And so we find that those are very stable cases that we're
Mhm.
able to really help and assist in that care process.
It, you touched on something that just was I was just thinking about, and you said the home care space is a non-licensed and there's no rules, and placement same thing, right? We come in this unregulated, non-licensed space, and so um, there's companies out there that send their own employees in, and there are companies that send 1099 or contract workers in. Um, what's the difference, and how do you guys handle that, and um, what's your feelings about that?
Yeah, that is a great question. And I will say that, even though home care in general is not regulated, there is no licensure here. But with anyone who's operating in the Altex contract space, there are requirements that we have to meet. There are supervisory visits that we have to do at certain points to make sure that the care is being delivered properly. There are background checks that we have to be doing to make sure that anyone who's providing the care is actually authorized to actually provide that care,
Hmm.
and to just make sure that all the compliance items are in, that they have all of their work requirements, all of the training. There is required training that has to happen through the DCW program, which stands for Direct Care Worker. And so in the Altec space, there's actually a lot more, I'll call it regulation, even though it's not licensed. In the space versus private pay. And then the other side of it, as you were saying, is this 1099 model, and
Hmm.
there are registries out there like care.com where people are hiring caregivers directly, and there is no regulation, there is no oversight over these programs. And what we found is that there's a lot more risk involved with the family because the 1099s, even if they're working for an agency who is able to follow the tricky guidelines to be a 1099 model, they are not allowed to supervise the care that is going on. They're not providing benefits. They're not providing workers' comp insurance, which puts the families at full risk
Yeah.
of anything that happens in that home. The family is going to be responsible. We pay employer taxes and the employment taxes that are involved when they're working, for us directly. So it's also better for the overall economy here in Arizona to be
Hmm.
able to hire people directly. So, this underground, I call it the underground care market, is really kind of on these 1099s and these registries. And I think if we were going to hope for any regulation, it would be on that line to make sure that anyone who is going to operate as an independent still has to provide insurance and the right qualifications to make sure that the care is being provided in a safe manner. There is no background checks being done with the 1099 model. They don't get paid overtime. So I'd say there's just a whole host of reasons why that
Could,
I don't believe that 1099 model is really viable.
yeah, I'm with you on that. And when families ask me for input, I always advise we need to get you a company that employs their own folks and has done all these steps, right? We even got a story that wasn't too long ago that I heard from a home care operator that knew, let's see, was it the family had hired a private individual, and after 2 or 3 years, the person that they were caring for passed, and then that person filed for unemployment. And of course, the family was like, "What are you doing?" And they're like, "I don't have a job anymore. I need unemployment." And the family was held to be responsible because they had not. They just were paying the guy under the table all along, or the gal. So, anyways, I really thanks for taking a minute to talk about all that because um, we want to be in our resources to families as people talk to us, man. I want to give it. I want to emphasize those things that we're trying to do to protect the consumers. Your industry, my industry at placement, the moving industry, the senior move managers, the care managers, the advocates. None of these people are none of us are licensed, right? The state has no oversight. Here's this whole segment of our population being served by lots of really good-hearted people like you and my team and whatever, but there's an awful lot of other stuff that happens, and so we just want to alarm people to be very cautious and take your time and diligent to when you're looking for services to find ones that are connected to the right spots. You've been super involved in advocacy work too, and I know you. Um, you want to talk about what you've been trying to do and some of the advocacy
Back
work? And I just
to it really starts from before I got into this industry. I was actually in the fast food industry before this, and what I found was I'm a heart person, and I need to feel fulfillment that I am leaving this world in a better place than where I found it. So I think it starts there. But as I was looking for an industry that really connected with me, I was seeing these home care agencies out there, and it kind of reflected back on a hospice experience that I had had, where my grandmother was living with my parents when she was going through her cancer battle and ultimately, passed. But we had hospice coming into my parents' home to help care for my grandmother. And my wife and I were going into the home to help care for my parents who were helping caring for my grandmother. And what we found is when hospice came, it was such a relief. It was such a relief to
mm,
have a skilled person in the home that had that experience, that knew what they were doing, that could guide us through that process and just really help kind of provide comfort. And so that really resonated with me. I was like, this is just an amazing business to be
mm,
in. How amazing is it where you can help people in the most challenging times? And even though you're going through these terrible situations, it can be uplifting and comforting, to have that help. So it kind of started there. So as I found home care agencies that were out there, I was excited to really jump on those and get into the industry. So I kind of started from a very small place of 50 clients, and we've now grown our census to over 800 that we're caring for daily.
holy smoke!
So we've grown quickly, and then along the way, it's like as you grow, or as you age, that these situations are going to come home at some point. Our mother, our father, our grandmother, grandmother are going to be dealing with these care needs, and so I don't think
Mhm.
home care is going to touch all of us at some point. We just don't know when. And
Right.
unfortunately, home care hit me pretty hard last year when my father had a fall out of state and hit his head really hard and was in ICU. And I flew out to Massachusetts to help care for him and help him get through the rehab process so I can bring him back home so that we could provide care for him and try to help him improve from that injury. And we had him through 24-hour care. We had him with home health services, and it was such a relief to me knowing that our team was there and helping provide that care. And unfortunately, I also saw through this system just how complicated and complex the whole healthcare system is. And unfortunately, like he did pass this last year, which was a very difficult process. And kind of goes back to my mission. I saw how challenging it was for us to navigate the healthcare
Mm.
system, even having this knowledge that I've been gaining over the last
Right.
decade.
Right.
You see one doctor who's telling you, well, you got to take this medication and you have to eat this way and do these things. And then you go to the next doctor, it's like, well, don't listen to that doctor. You know, you need to take this medication and go through this program. And it was just so frustrating to see that healthcare is not a team sport. And you know, it really should be the patient is at the center of the care, and everyone who has a touch point in that care should be connected and be communicating together. So as I saw that failure and I saw what that did to us and our family, it just added even more motivation to, I want to fix this. And I know
Mm,
one person can't fix this, but
right.
I'm definitely going to try. And I think as we move forward and start pulling all the different people in this industry together, I think we're able to really help move this system forward. So say all that to kind of come back to the advocacy side of things, because change, I think, starts with advocacy. We have to be
Hmm.
out there educating and talking about the issues that are going on to shine a light so that we can pull those big minds together who are motivated to try to make those changes. So I'm really honored to have a board seat with the ASNAHA Association, which is the Arizona In-Home Care Association,
Right.
and that is a collective of home care organizations that really do care about the industry and are trying to keep that standard up and hold each other accountable to those standards. And from that association, another association was born called EPDPA, which I know it's a mouthful. It stands for Elderly and Physically Disabled Providers Alliance. And
Hmm.
that is a subset of ASNAHA, but it's an association that is just focused on the Medicaid space. And it is a collective of Medicaid organizations. And one of the issues that we have been dealing with over probably the last 8 years and 10 years maybe is the lack of proper reimbursement rates at the
Right.
state level so that we can actually pay these caregivers properly. Caregiving is not easy work. It is not something where you can come off the street and go into someone's home and be able to provide a great service. It requires training and education and mentoring and handholding, and it takes time to really develop into that quality caregiver. And so, you know, to be in an industry in the Medicaid side where we don't have the means to care for the caregivers properly, it just hit me so hard that man, someone's got to be fighting for these people that are there are heroes. They're out there every day putting their lives at risk, especially during COVID. It was amazing to see what was happening, and so I just
Hmm.
feel like I owe these people. We all owe these people a debt of gratitude, and that means having a competitive wage that really reflects the value that they really provide to our communities and to our families.
And
Uh,
too often, and I'll just tell you right here, you mentioned earlier, your Medicaid clients have all this extra oversight um, requirements on their behalf to be able to provide it. And if they're paying you less than the normal standard rate, I mean, it's just so it just makes sense that you have to work collectively to lift that up so that you can maintain their expectations, and you can't run it at a loss, right? That's not, business isn't, you can't run it at a loss. So if you're going to keep expanding, it's got to be in a way that's financially viable. um, God bless you. The assisted living people need the same, and I've said this for a long time. Like our friends at the assisted living homes, centers, and homes, they need a 2.0 version of your advocacy group, because they need to be talking to the Medicaid, the ALTCS program in the same way. When I try to find placement for people, we can't find the best providers under the ALTCS umbrella a lot of times because the best operators don't want to operate for the reimbursement that Altex is offering. So God bless you. You're making progress. I imagine if you keep at it, you must be making progress.
Yeah, you know, I'm really proud, you know, to really share that, you know, since 2018 when we formed this association, we've been able to infuse about $2 billion of extra funding into our industry. Some of it, you know, was from the ARPA program, which we had to work to get that money released. Even though it was established, you know, from the federal government. So it did take a lot of advocacy, a lot of work. We have an amazing lobbyist who is out there every day working on this, having the meetings. I was living down at the Capitol
Isn't
for
that fun?
years, having these meetings. It was a very eye-opening experience, and I
Yeah,
remember when we started. And I do serve as the president of this association. I remember telling everyone, I've never done this before. I don't know what I'm doing,
right.
but that's not going to stop us. We're just going to figure this out, and we're going to keep at it and make sure that they hear our message and that they understand the value of what home care really brings to this state. And we've been really happy to see the results over the last couple of years. We have a ways to go still. And it's an uphill battle, especially when the budget is not in a surplus state. It's very challenging to try to get a rate increase
Yeah.
while the state is going through these challenges. But I'm still young, and I'm a fighter, and I'm going to keep going until we get there. And I'm not leaving this industry until we've achieved the results that we're looking for.
Well, I got to tell you, I'm super proud to know you and to be aligned with your company and you directly, Aaron. You are one of the crusaders in this industry, in our industries collectively. We need more crusaders. Our parents deserve it. We have a saying here at Connectors: "It's our turn now to care for those who loved and cared for us." Right? It's our turn now. And so, as a business owner, you're a business owner. It's our turn now to do what we can for you that are our audience. It's your turn now to step in and do things for your folks that you never would have dreamed of. And so we just want to bring our resources. And Aaron, thanks for being here today. You get to meet Aaron. You get to meet some of our attorneys and our care managers and our placement folks, and we're all here. So if you're watching this and you have questions you need answered, whatever, you can just reach out to us, email, call the office. Our advocate and our family advisor will get back to you and even come see you and do a face to face, and then actually connect you to our partners like Aaron and his team. So
I'm really grateful to really be able to share, and just want to say that we appreciate what you guys are doing out there, bringing awareness and attention to this space. Is really kind of that first step to help really make sure that we're able to make these changes. And I love what you were saying earlier. Like, we are all going to be touched
mhm.
by this industry at some point in our lives. And I think, for all of us to be thinking about what would we want if we were in that situation. And that's how we need to approach this and make sure that we all deserve great, great care. We all deserve that quality of life, and we all deserve to be able to age in the place that we really want to age in.
That's right. That's right. Totally, Gary. Listen, thanks for joining us today. Aaron, again, we appreciate your time. To our audience, our contact information will be posted through the end of the video here. If you need anything, get us at seniorresourceconnectors.com. And once again, thank you so much. Thanks for joining us. Have a great afternoon. Take care.
Thanks, Scott. Appreciate it.
You bet.